Hey, everyone. Good to see so many folks on here early.
Hello.
Hey, Dr. Hoffman. It
Good
looks like,
afternoon. This is Erin with the Department of Medicaid. It's not quite 1:30 and we're still clearing out the waiting room, so we'll give it just a few minutes before we start. So far, Emily, I have you and Brenda logged in, and you're the only members I have so far, but I'll keep an eye out.
okay, great. Thank you. Glad you could join us, Brenda.
Emily, it's now 1:30, but I still only have the two of you on if you want to give it a moment longer.
Yeah, let's give it another couple of minutes. Thanks.
Miranda is currently joining, so that will give us three. I don't know if you want to go ahead and proceed once she gets logged in, and I can keep an eye out for others.
Yeah, why don't we go ahead and do that once once Miranda's in the room, we'll get started. I saw Brenda right below me, so I was saying that.
Hello.
Hi, Brenda. Good to see you.
Hi.
And Miranda, it's nice to have you on.
Hello.
Thank you for joining us.
Mhm.
It's currently the three of us. We can go ahead and do introductions. Hopefully, we'll have some other TAC members joining us. But I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and chair of the Consumer TAC. Brenda and Miranda, why don't you go ahead and introduce yourselves?
Hi, I'm Brenda Menino. I am the liaison with the AARP. There are a few citizens over 65 who also are on Medicaid. So
I'm Miranda Brown, and I am the representative on the TAC for the Kentucky Legal Services Programs.
Well, thanks again for joining us today. We will get started. We do not have a quorum at the moment. If we have another TAC member join us, we will have a quorum in which we can actually make recommendations and vote at the end of this meeting. But otherwise, we will move ahead. Oh, and approval of minutes, which we can't do without a quorum. So we'll skip that. We will go back to it if we do have another member join us. So we'll move on to old business. And we always like to start with the status of the number of folks enrolled in Medicaid. So
Sure.
I'm trying to look at
Hello, this
everybody's
is
here.
Jordan. Can
Jordan,
you all hear
there
me?
you are. Thank
Yeah.
you.
Hi, my name is Jordan Griffin. I'm the Eligibility and Enrollment Branch Manager here within the department. And as usual, we'll start with our presumptive eligibility numbers, and I'll post these in the chat as well. We have 1,525 individuals in the PE program. We have 319 individuals receiving emergency time limited Medicaid. We have about 149,801 individuals in fee-for-service Medicaid, and we have 1.3 million, over 1.3 million in the expanded Medicaid, for a total current enrollment of 1,458,003 individuals.
Can you say that total again?
Sure, it's 1,458,003. I'll put it in the chat there for you.
Yeah, that's great. Thank you.
You're welcome.
Any questions about the enrollment numbers?
Is there a separate number of who are under the expanded Medicaid?
So the weekly membership count that we get this number from, it breaks it down into fee for service versus managed care. But so like the fee for service is what we consider, like the traditional non-managed care Medicaid, and then we have the overall enrollment is the 1,308,202.
I think we've sometimes had it broken down with traditional versus expansion eligibility in a different way, Brenda, if you're just wondering if those numbers sound different to you. But this is essentially fee for service versus those enrolled in MCOs and managed care organizations.
Okay.
Yeah,
Well,
Does
sorry.
that
If you
make
were
sense? Or-
wanting that specific kind of breakdown, I can try to do that in the future. I'm so sorry.
No, we've had it both ways, and
Yeah.
I think the information is good either way, but I wasn't sure if that was what Brenda was
Yeah, that I
about
thought
or
I
not.
had seen it broken down that way before.
Yeah, so Jordan, if we could look at national eligibility versus expansion eligibility, and that actually could be more important right now as there's so much conversation at the federal level about changes to Medicaid funding and whether or not that would have an impact on the federal match for expansion.
Sure, I can break it down into
So
those
no,
figures for the next
that
one.
population is okay. Yeah, it would be helpful to know who's most at risk of potentially losing funding or coverage. All right. We have also on our just standing list of data requests, Kentuckians receiving, and I should probably switch this around, the 1915C waiver services. But then we'll go back to the child eligibility and enrollment.
You want me to go ahead, Emily?
Yeah, whoever wants to go
It's
first.
Leslie. I'll go ahead.
I should probably put the 1915C after the child enrollment.
I'll go ahead and give them this time, then you can change if you want to. How many Kentuckians receive 1915C waiver services or are on the waiting list? Of course, folks can be in varying stages, but currently right now we're at about 32,505. Now we do have, as you're aware, some slots that are reserved for like money falls to the person transitions and things like that. We also currently have about 14,175 unduplicated on all the waivers. I do want to just caveat here, as I usually do, we have about 37% of the members who are on more than one waiting list and or are in a waiver and on another waiting list. So maybe they want the SCL waiver, but they're in the HCB waiver. So there's about 37%, if you take a look at that, that actually are receiving services somewhere else. Most do have access as well to state plan. Most are Medicaid eligible and do have eligibility to any state plan services that we currently might have just in the state plan. As far as the HC, oh, sorry. Go ahead.
I just wanted to clarify, when you said
Yes, go ahead.
32,500, is that on the waiting list? And then 14,175?
No, 14,175 are what's on the waiting list right now.
On the waiting
To
list,
break
and
that
that's
down.
unduplicated.
Yeah.
No, I got it. Thank you.
And I can, if you need that, I can send it to you later, after the call is over. I'm sorry.
No, thank you. And then 37% of the
About,
waiting
yeah.
list, is either on more than one waiting list or has one waiver and is on.
Yes, and most also, I don't have that percentage with me, but most also have
Right.
availability of state plan services. They have Medicaid and have availability of state plan services, even if they're not on the waiver.
Okay. All right. Thank you.
Um,
Questions about waiver enrollment? Oh, did you have more to share? I'm sorry, Leslie.
Just one other thing that you might be interested in is that you're aware that the state budget did include slots for fiscal year 25 and also included slots for fiscal year 26. So we will be able to add 1,275 additional slots for HCB, Michelle P. waiver, and ABI LTC. And there's a breakout of that, and I can put that in the chat if you need me to. It's
That would be
500 for HCB, 500 for Michelle P, 250 for SCL, and 25 for ABI.
Okay. Yeah. If you could share that in the chat, that would be great.
Yeah.
Thank you.
And that's all I had for that one.
Okay. Any questions related to waiver enrollment?
So the 32,505 was the number of people currently utilizing waiver services total.
Yeah, and I've told you all before, it's fluid. So I mean, I could check it right now and it would be different from the numbers I ran this morning. So it's approximately.
I think that's helpful. Thank you.
I usually round it off to 33 if if folks are asking me for a big picture.
All right. Well, I appreciate those updates, and why don't we get the data on current child enrollment and renewals, and then we'll go back to some of the waiver requests that we have here.
Sure, this is Jordan again. So right now, there's still no change. We're allowing the auto extension for child renewals still through June, per the flexibilities granted by CMS. And we're planning to have an outreach campaign this spring at the schools with our advocates, providers, and on social media when the restart of July renewals is beginning. So, and then right now, as far as enrollment, we have 570,954 children who are in an MCO program, and then we have 26,323 that are fee for service. And I will post these numbers in the chat as well.
Thanks, Jordan. Now back to you, Dr. Hoffman. We have, I think, just kind of kept HCBS waivers, federal final rules and rate study on our agenda for the past many meetings. Are there any updates there to share? I know there's also been a change in federal administration that may have changed the direction of some of these things.
Yeah. First of all, let me just talk about new administration. At this time, I've not had any changes in programs. I know there's fear out there, fear of the unknown, but have had no changes, no indication. I just wanted to let you know that because I get that question a lot. People are afraid. So nothing right now. The communication's been either slowed down or quiet on some programs, but nothing to indicate that that we have anything to worry about just yet. So I just wanted to let you know that. Couple things I thought you might be interested in, Emily, and I pulled together is for the HCBS waiver renewals, we have the HCB waiver and model waiver 2 that are in their 5th year that will need to be renewed this year. And all those current processes that we go through, folks will be involved, we'll have public, comment, and it'll be posted and all those things. So right now, I believe for the HCB, it was August, and I believe for model waiver 2, it's October. I'm pretty sure that's correct. So we have already started working on those things, but we're still a while away from being able to submit anything. Of course, we would have formal communication going out to all folks related to those things. As far as the federal final rules, I would just, I think we've mentioned this to you before, maybe you've even seen a presentation. We have a contractor that is assisting us with the many federal final rules that have come about. There are 3 or 4 that are going to impact the HCBS, including some quality measures. So currently right now, we've been discussing heightened scrutiny in general, as well as HCBS quality measures and some involvement of the Money Follows the Person grant. They have allotted some assistance dollars and one FTE, which is a full-time employee, to assist with quality measures. So I just wanted to let you know that is kind of strange. I think they might have utilized that mechanism because 47 of the 50 states have MFP demonstration grants, and they could flow the funds through very easily for that. So we're working with our Money Follows the Person branch, as well as our new contractor and other internal folks that we have here at Medicaid. As far as the rate study goes, I think I might have given this to you all, or maybe this was on a different TAC. The rate study has been completed. It's on our website. The rates were approved effective January the 1st of 2025. We did submit, you're aware that we submitted regulations that pretty much just included those rates because we didn't want any delay. So we will need to go ahead and go back now and complete additional regulations that kind of help align our regulations with our waiver applications for CMS. But just wanted to let you know that as well. Folks have asked about, additional funds that might come about for the rate study and or increases. And right now, my answer is that we would need appropriations. We've completed everything we were supposed to and what was allotted in our budget. And we would need additional appropriations, of course, from legislation during next session to be able to do anything past what we've already done.
Okay, that's helpful.
Yeah.
And good to know that the rates were approved in January. So are those in effect now?
Yes,
Even
they
though
are.
you still have to
January
work on
1.
the regulations? Okay. Any questions related to that? So the next item on our agenda is the 1915I SPA and the 1115 waiver for supported housing and employment for people with SMI.
And for the 1915I SPA, I'm going to call on Ann Holland, who is our representative and liaison at the Department of Behavioral Health, who will be administering the program for us. So Ann, are you on?
Yeah. Can you see me? Can you hear me?
Yes.
Okay.
I
Good
am.
afternoon. So DMS officially submitted the state plan application back to CMS in January, and last Thursday we had a call with CMS and we have some technical changes to the application, but they did tell us that we are working towards approval, which is good news. Our goal is to train and onboard providers prior to starting an assessment process for participants. Of course, system changes for provider enrollment, billing, and integration of the functional assessment tool are key factors associated with implementation, and the team is currently working on these tasks. We're also working on developing community education tools about the 1915 I-RISE initiative. That's quick. Without a final approval, we don't really have things set in stone yet. So we tried to give these little updates, but I will defer to Dr. Hoffman if she wants to add anything.
Emily, I think you and I spoke about this before. I think we're just kind of We are not slowing down while we're waiting for CMS to finalize that. We've not slowed down at all. Matter of fact, we're way ahead of the game and trying to run simultaneously the things that we would need to implement, systems changes, partner portal, just like Ann said, MWMA, the application, the assessment tool, all those kinds of things we're kind of running simultaneously. What our go live in July, we've been talking about that, and we can share more with you later, what will go live look like in July. So it might be Kentucky go live, which might look a little bit different than, our regular go live with full implementation on day one. But we didn't want to slow down, and we wanted to get that application into CMS prior to new administration.
Yeah, well, we appreciate that. And when you mentioned some technical changes working toward approval, are these is kind of the last step before approval? Or is there another part of the process?
No, I think they want us to have the cleanest application possible. And so it's just little tweaks. I mean, it's not changing the definition of any service we have or anything like that. It's just little technical tweaks.
Excellent. Well, thank you for those updates. I see that Arthur has joined us. Welcome, Arthur.
Hi, Arthur. Can I ask a question? You talked about with SMI. What does SMI stand for?
And do you want to take the questions, or do you want me to? Severe mental illness.
Thank you.
And-
I think Mr. Arthur want to say something.
Go ahead, Arthur.
He said he messed up. He lost. You lost your way. He said he lost the real page of this meeting, so he had to look for it for a while.
Well, Arthur, I'm glad you were able to join us, even if it's a little late.
And he said, and he wrote something. Real. Will. Oh, he said he wrote something, and he was wondering if somebody can read it.
Yeah, absolutely. Do you want to put it in the chat, Arthur?
Yeah.
Okay.
Emily, did you want me to give the SMI 1115 update as well?
Well, I did, but I wasn't sure if Arthur was putting something in
Oh,
the
I'm
chat
sorry.
now or
I
if it
was
was
waiting. I'm sorry.
later.
I'll wait.
So I was just kind of
apologize.
pausing for that. But Arthur, would you like to put your statement in the chat now or later?
He said you guys can continue. He's looking for it.
Oh, okay, great. Yes. Why don't we go ahead?
Yeah, so I was just going to mention, as Ann was speaking about the 1915 I-State Plan Amendment, if you all remember, this is a companion to the 1115 waiver. And in order to meet the public's request and Senate Joint Resolution 72, I believe, we ended up asking for things under both authorities. So we originally sent in an SMI 1115 that had two components, one of which was IMD that allowed for expanded days up to 30 days statewide average length of stay for the mental health treatment and facilities that are considered IMDs. We also at that time also sent in what was asked for that looked like medical respite, and in the federal world they call that recuperative care. And the only place that we could see that we could get that approved was through an 1115. Since the time that we've been working with CMS though for that recuperative care, we they have since moved it under, I know this is confusing, under a different arm of our umbrella. under a health-related social needs arm. So I'm kind of excited though that we've got a health-related social needs arm now. So that's kind of nice. So we have that. I was trying to think if there's anything else that's been approved. I'm sorry, we've been working through some things with recuperative care. It required some additional project management plans as far as access to services, I think, and systems. So Jody has submitted both of those, and I believe both of those are already approved. So, and I think we have, I'm trying to think, on the SMI in general, I think we have to have an implementation plan back to CMS by March the 12th. And we do have that already drafted. So it's not just sitting around. It's a preliminary draft. Of course, we'll pull in our sister agencies to review that as well.
Did you say March 12th?
Yes. Mhm.
Okay, excellent. Well, that's all good news to hear that some components of this have been, or all the components of the 1115 have been approved by now.
I'm trying to, so with, for example, the reentry on the implementation plan, that didn't get like full approval yet, but CMS told us to go ahead and move forward. So you've been seeing all kinds of communication probably coming out related to reentry because they told us that we could go ahead and move forward. So
Okay.
communication's a little quiet right now. They have continued some of our meetings. Like I said, on the recuperative care, we did find out that that required, because the type of service it was, a health-related social need, it required a couple more protocols. Which makes sense to me. We've never done one of those before, so that was something new that we had to work on and completed as well. All the other components, I'm trying to think, are approved. Team Kentucky, former foster care, all those are have been approved.
All right. Well, thank you. That's a really helpful update. Any questions related to the waivers? All right. Well, before we move forward with our next item, which is actually a presentation on money follows the person, because I think there were some questions about that on the last call. Arthur, I wanted to go back to the minutes and just get approval of the minutes from our previous meeting. I know you weren't able to attend that meeting, but for folks who were able to attend, let me know if you see anything in the minutes that need to be corrected, or the transcript that we got from DMS. And Arthur, hopefully you've had a chance to look at that or watch the video.
He said that's one of the reasons why he was. Oh, that's one of the reasons that he was late. He was reading it.
Oh, okay. Well, good.
And he said it's all right.
I know it's a long transcript. Okay, well, I'm glad you were able to glance at it. And if I could get a motion to approve the minutes.
This is the December minutes, right?
I believe this is well, you know what? We might have to approve. We
You
didn't
need-
have a quorum in January. Therefore, we need to approve our December and our January minutes. I'm glad you said that. Is that right, Aaron?
Yes, ma'am.
Okay, so we'll say approval of minutes from previous meetings. So I would like a motion to approve both the December and January minutes.
So moved.
Thank you, Miranda. A second?
I'll second it.
Okay, it sounded
And-
like you and Arthur were both saying aye at the same time. That's great. Thank you all. Let me just get my notes down. All right, and all in favor say aye.
Aye.
Aye. Any opposed? All right, motion carries. Thanks, everyone. All right, so we'll hop back down in the agenda to our presentation on money follows the person.
So, Emily, I'll just get us started, and then I'm going to turn it over to Robert Duff. Robert Duff is our project director for, we call it Kentucky Transitions here in Kentucky, but it is part of the Money Follows the Person demonstration grant that has been around for a very long time. And I thought you all might be interested in hearing about it again. I think you had some questions last time. It's a wonderful project. We've done some wonderful things, and I just thought it would be a good opportunity. So, Robert, I'll let you take it away.
Well, thank you. I want to thank everybody on here for affording us the time to bring our message to you all and answer any questions. Again, it's going to be a quick overview. I don't want to take up too much time, but it is going to go through the highlights of what Kentucky Transitions is, show you who the team is, eligibility criteria, benefits, and enrollment, and just have some quick question and answers. May has. We have 8 people who work within Kentucky Transitions running the Money Follows the Person program. It's myself and quality assurance, Teresa, and then 2 housing specialists, and then 4 transition coordinators. We have those broken up across the state. The MFP, the Money Follows the Person program, it's a demonstration grant from CMS that started in 2007. Initially, 46 states were awarded grants through attrition and everything else. In 2022, they re-awarded 5 new grants, bringing it up to 47 active programs, including 2 U.S. territories. Since inception, over 100,000 individuals across the nation have benefited from the transition services through MFP program. There's 4 basic goals of MFP program. It's to increase the home community-based services and help individuals get out of institutional care. Help eliminate barriers in the state within their regulations and Medicaid plans, bringing people into the community. Strengthen the ability for the Medicaid programs providing home community-based services to individuals who will have a freedom of choice of their services and the method they want to receive them. And also put procedures in place for the improved quality of the services and funnel it up hopefully within the 1915C waivers as well. In 2007, Kentucky Transitions was among the first to be awarded a program status, and Kentucky Transitions was created to run the MFP program in Kentucky. It's designed to help Medicaid members who are in institutional care to return to the community living with the freedom of choice of services that fit them and their needs. Since 2008, we've moved over 860 individuals through our program. We have a very good success rate of keeping them in the community. Our impact has hit 103 of the 120 counties. That means we have placed somebody in 103 of the 120 counties across the state. We don't tell them where to live. They get to choose where they live. So I would love for it to be 120, but there's some counties people just aren't really drawn to. So I don't have much choice in that. We are aligned with the 1915C home community-based waivers with HCB, ABI long-term care, and starting January 1st, that we've reintroduced the supports for community living. This does help the population of physically disabled, elderly, those with mental illnesses, acquired brain injury, and those with primary diagnosis of intellectual and developmental disabilities. And if I'm going too fast, somebody stop me. I want to respect y'all's time too. So the eligibility criteria is based out of the regulations from CMS mostly. You have to be living in an institutional facility for 60 continuous days. Medicaid has to pay for one of those days. Meets nursing facility level of care. Be Medicaid eligible without subsidized plan. You can't be a managed care program in this state, and then be able to live in the community with supports and services. Other benefits of full transitional planning and support is available to individuals who are referred to the program. We ensure a continuity of care, which means there is a waiver slot position for those individuals who participate in Money Follows the Person, Kentucky Transitions. And so after you have a demonstration year of 365 days, you would roll over into the full waiver, the 1915C waivers. We have funding set up to assist individuals to do a household setup. At this time, it's capped at a maximum of $2,500 per person, and it is a one-time use for persons only. You can't be re-referred several times. Once you've referred, utilized our services, that benefit is gone. We also have home modifications for accessibilities. This can help individuals build ramps for egress to their living quarters if they privately own it. Sometimes door widening or accessibilities for bathrooms can be done as well. And that is also a one-time only. Pre-transition allowable expenses will include setting up the deposit and security for an apartment or a rental unit. Individuals in nursing facilities, they only get $30 or $40 a month. It's hard for them to save for the amount of money that it takes to secure rental agreements. We can also do furnishings and bed linens, kitchen household supply appliances, set up with necessities for a good household apartment to get your legs up. We can supply the kitchen with food subsidies to ensure food security, durable medical equipment with physician's orders, and pre-transition transportation. And then in the rare occasion, pest eradication if necessary. But all of that is encompassed in that $2,500. Our housing benefits, our two housing specialists, they network across the state with the housing authorities. They work with them to identify available, affordable, and accessible housing for the members. They work with the members to make sure that they have all the documentation and paperwork and get their applications into those housing agencies. They educate with what a good proper tenant is, because some of these individuals have never ranked before. We also do, if they have their own home, we do a home quality standard inspection, and those are non-subsidized units, would be taken into an inspection criteria to make sure it's up to HUD standards. And then if needed, we do home modifications such as I said, ramps, door widening, accessibility for the interior of the structure. But all that has to be inspected and meet all the codes and regulations. This is just the enrollment process. Basically, anybody can refer a member to Kentucky Transitions using our pre-screening referral. It is on our web page, or they can fax it, call, anything you want, any way you want to. We take it from anybody. People call me all the time asking if a family member can yes, I've had nurses from dialysis centers refer individuals, guardians, ombudsmen, and their own person. And the most of them we get are from the social worker at the nursing facility at this time. Contact information. We can always be reached at our toll-free 877-564-0330 number. And then that'll allow you to pick who you want to talk to. I'll be number 1, the project director. And I can forward you to anybody else on our team. Or you can send us an email at kentucky.transitions@ky.gov. And if you're interested in more information, you can always Google Kentucky Transitions, and it should be the first CHFS website that pops up.
Well, thank you, Robert. This has been really good information, and you may have covered this, but I had a question. In
Absolutely.
terms of eligibility, do you have a limit of how many slots that for money follows the person, or is it just based on eligibility criteria
So-
alone?
So for us to run the program in the state, there has to be slots reserved within each waiver. I think initially they set up 150 with the HCB waiver. We don't have the manpower to move 150 in a year. So it's, they went way above what we think, but we can grow into it. I believe there's 5 acquired brain injury, long-term care slots. And I'll have to get back with you with the SEL. I think it's 10. But
Okay,
Robert,
That's
that
helpful.
sounds right. And you can send that information to Emily or send it to Erin so she can track,
Yeah.
track that we've sent it. Emily, just to mention, so in order for CMS to allow us to do this, we had to have, years ago, had to have an ability to tell them that we're going to safely transition this person, right? So they've come out of a facility into the community with a waiver slot for 365 or through MFP for 365 days. And then what happens? So we got CMS to agree that if we earmarked or reserved a slot in those waivers for folks, that was our transition plan. Our plan was to allow them just to flip right over into one of those available slots. So you've heard me give numbers out before as far as our availability of numbers. That often includes those earmarked for MFP transitions.
Okay.
it's that part of the continuity of care.
Yes. Thank you.
Yeah. Well, the what? Yeah. Right. Know. Yeah. The program? Yeah. This program comes. This program comes out of. Yeah. Yeah. Comes out of home, homestead. Yeah. Yeah. Homestead.
Robert, is your current grant still through Robert Wood Johnson Foundation that came out from?
The program is out of it. The grant comes from directly from CMS, the Centers for Medicaid and Medicare Services.
DEI. Hello? Yeah, it's alphabet. He's in the meeting right now. Can you call back later? I'm going to come to
Are there any other questions about money follows the person? Okay.
So I just want to make sure I'm understanding completely that like someone doesn't have to be enrolled in a waiver to start utilizing money follows the person. They're just guaranteed a slot in a waiver at the end of it.
After the 365. Sorry, Robert, you speak. I'm sorry.
I was just going to say, to be eligible for participation with Kentucky Transitions MFP, they have to be institutionalized. And that means they really can't be enrolled in the waivers. Through our program, we sign them up, we set their plan of care, person-centered support plan, and it's all in line and has to follow the same regulations as the 1915C waivers. So the hours of attendant care are set, and the same mechanisms are there for the providers to follow the same way. And it is the same providers that provide the services and supports through the waiver. So when they get to about day 300 after they leave the institution in the community, their case manager will set up a application in MWMA just like anyone else would, and they get reassessed rather than the original assessed. But they do the same process as everyone gets every year with the waiver. And then they would roll right into the waiver that they're eligible for.
And would no longer be in the transition part of the
Right.
program.
Right.
Makes
And
sense.
transitions, it's just a funding. It's behind the scenes funding, basically. It allows us to charge CMS through the MFP program for that 365 days, but the rates and everything else is the same. It should be seamless to the individual and the providers.
It's supposed to be smooth transition, Emily, and it's supposed to be, almost like a safety mechanism to ensure that that person's got somebody following them along the way. So money follows the person. That's how the name came up for the federal government. So it's a really good program, and I know that you all hadn't heard about that for a long time. And they're kind of I've even asked for a spotlight this month for folks to get to know about MFP again. It's just one of those wonderful programs that we've been involved with, for almost 20 years that folks have just forgotten about.
Yeah, no, this has been really helpful and informative. So thank you all for that
And I
presentation.
don't know if everybody's on here, but if there are questions or something, feel free to contact me and I'll get back with them. Any questions, but I appreciate y'all's time. Thank you.
Thank you. And I think we'll be getting the slide deck from Aaron as a follow-up to this. As we were just wrapping that up, I remembered that Deputy Commissioner Veronica Judy Cecil had asked me to move the Beneficiary Advisory Council discussion up higher in the agenda. And I intended to do that, but I never changed it on the actual agenda. So I don't believe that Veronica is here with us right now, but Jonathan Scott, are you going to be presenting on or just providing us with an update there, or is it someone else from DMS?
Hello.
I'm sorry. I hope I hope I'm
there's
not too
Nicole.
late. And
Nicole Kaufman from Mercer is going to
okay,
be leading
Nicole.
the
Okay,
conversation.
Yes,
fantastic. And sorry, Nicole. I hope you still have enough time in your schedule for this.
I certainly do. Yeah, my
Okay.
conflict disappeared, so we are fine. I'm happy
Great.
to jump into the topic now, or we can proceed with the agenda as planned, whichever.
No, I think, well, why don't we go ahead and just cover the back? That's a high priority for us, and I want to make sure we have plenty of time to discuss it.
Absolutely. All right, so I'm going to share my screen. All right, can everyone see the first slide of a PowerPoint deck?
Yes.
Very good. All right, so my name is Nicole Kaufman. I am with Mercer Government, which is a consulting firm that's supporting the Department for Medicaid Services on implementing the MAC and the BAC, or the Medicaid Advisory Council, Committee, and the Beneficiary Advisory Council. We're going to spend some time highlighting the public feedback received from the MAC and BAC survey, as well as webinars that were conducted in December. And in particular, we're going to focus on comments related to the Beneficiary Advisory Council. So just to kind of quickly preview the agenda. So we're going to recap the outreach strategies that were used on the MAC and BAC, summarize the public feedback, and then certainly reserve time for questions you may have. A couple of just quick logistical things. I do believe that the deck we'll be using today will be made available to you. You can certainly ask questions you have in the chat function in Zoom. I'll try to address them as I'm going through my prepared remarks, but we do want to have time for questions. And at this time, I do not have updates to share on the status or content of the pending legislation related to the MAC and the BAC. All right. Okay, so as a reminder, because again, may have been some time since we talked about the MAC and the BAC generally, there were changes in federal law that require the Department for Medicaid Services to create a Beneficiary Advisory Council. So this would be a new entity where membership is limited to individuals with lived experience with the Medicaid program. So current or past Medicaid beneficiaries, their caregivers, paid or unpaid, as well as family members. And then we'll also require some tweaks or changes to the current Advisory Council for Medical Assistance. These entities need to be implemented by July 9th of this year, but that does not mean that their first meetings need to happen by that date. All right. So the department held 2 webinars. The first was held on Monday, December 16th. and the second on Wednesday, December 18th, from 1:30 to 3 p.m. Eastern, to provide a background on those federal requirements and to seek public input on the key decision points to both comply with federal requirements as well as to enhance the process for external partner feedback. The Gov delivery email distribution list that the department has was used, as well as social media and the department's website to inform the public about those webinars that were held in early December. Now, note here that the number of people who registered was ultimately different from the number of people that attended these webinars, but that was to be expected. So for that December, the first webinar, there were 412 registrants and 199 people attended. And then for the December 18th webinar, 313 people registered, and then ultimately 152 people attended. Now, for those of you that attended the webinars live or have listened to the recordings that are also on the department's website, we do hope that you found or agree that the topics of the MAC and BAC really resulted in thoughtful discussions, and we heard from a lot of diverse perspectives and voices. For those webinars, individuals interacted in a facilitated session, and then we're also able to provide comments through the Q&A function. And then the webinars at the end included a QR code to the survey, and then the QR code and survey link, as well as the recordings of the webinars, were posted to the department's website shortly after that second forum on December 18th. Okay. So now let's look at some of the statistics related to that online survey. So in addition to posting that survey link as well as the QR code on the department's website, the invitation was sent to over 500,000 email addresses. Okay, 94% of the invitations were sent to active email addresses. So there was no return message that the recipient was unavailable. And then the information to access the survey was also posted on social media. In terms of engagement by individuals who received an email invitation, 23.4% of the emails were opened. Of those opening the email, 2.6% or a little over 3,000 clicked that link. When it was all said and done through that email invitation approach, we received 668 submissions or responses right to the survey. And of that 668, 502 of the responses actually provided feedback that was responsive to at least one survey question. And then, so as to be expected, some individuals who submitted a response provided comments on other matters, such as individual circumstances, and the department received that feedback to follow up on. All right, and then quickly in terms of social media engagement for the survey, here we have some figures on engagement with both the Facebook and then LinkedIn posts. Ultimately, in terms of individuals viewing those posts, was almost 900 views. All right, so let's look at, in terms of the 668 responses to the survey, what did the makeup look like? So the survey did ask for individuals to provide their affiliation, right, which the affiliations are provided on the slide. But we do want to note that the counts on the right-hand side of this slide may not be reflective of all survey respondents, as many of the surveys, people picked more than one affiliation. So maybe, for example, Medicaid member, and family or guardian, right? But when it's all said and done, we do believe that people with lived experience with Medicaid were the predominant types of responses and voices that were heard. Okay. Apologies, they're going too far ahead. Okay. So what we wanted to show here is that we're not going to spend a lot of detail on this slide, but there are a number of areas of how the BAC and the MAC will operate where the federal law says how certain things need to happen. So the state doesn't have much discretion. So one I'll call out here is that there needs to be at least 25% of members on the Beneficiary Advisory Council ultimately need to have a seat at the MAC as well. So they just wanted to provide this here for reference as to those areas that the federal government says must occur. So let's dig into the survey in particular. So the survey questions focused on aspects of the current advisory structure. So the Advisory Council for Medical Assistance, as well as the technical advisory committees. And in particular, what works well for those groups and what does not. Also asks questions about how MAC and BAC participants should be supported so that their participation can be maximized. We also ask questions about the selection process for the MAC and BAC members, as well as other suggestions or comments related to these advisory groups generally. Now, in the webinars, there were targeted questions asked about areas where regulations, allows for some flexibility in design. And then ultimately, we received feedback kind of in these 7 key areas here. So what does membership look like for both of these groups? How big should they be? How long should members serve? The selection and appointment process for members, additional subject matter expertise that could support how these groups operate, how often they should meet and how, virtual or in person, and then ultimately member supports to maximize that participation. All right. So let's get into the substance of the feedback. And again, the slides here will reflect responses related to the MAC, as well as the BAC. We're going to focus primarily on the Beneficiary Advisory Committee. So in terms of who should be on the Beneficiary Advisory Council, received feedback really emphasizing broad representation that reflects the diverse needs, and aspects of Medicaid, the Medicaid program in Kentucky. So that includes focusing on things like gender, age, geography, as well as the types of services that individuals are receiving. So make sure there's representation of individuals that have engagement with the behavioral health system. There were comments related to dual eligibles so individuals who are on both Medicare and Medicaid having a spot on the BAC. Also comments about children with special healthcare needs having representation as well. And then I mentioned earlier, that the BAC can have, needs to have both current or former Medicaid beneficiaries as well as their family members or caregivers. We received some suggestions as to how that should work, within how that split should work. So there were some comments about a half and half in terms of recipients versus caregivers or family members, or 60% Medicaid recipients versus 40% being those caregivers or family members. And then certainly I didn't mention it in my remarks, but on the slide there, a lot of comments supporting representation for individuals on home and community-based waivers. Okay, in terms of how large the BAC should ultimately be, recommendations ranged from 13 to 19 members. For length of appointment, it was really varied. So comments ranged from 2 to 6 years. And I think one of the issues is, as we all know, Medicaid is a complex program. And so it takes some time for people to understand the Medicaid basics, the types of policy items that would be subject to discussion. And so, shorter terms could mean that people are rotating off the BAC just as they're getting up to speed and feeling comfortable in their roles. But then there's the competing, priority, or consideration that shorter terms would allow more people to participate in the back. So some different, some interesting and important considerations there in terms of how long people should be on the back. Okay, so in terms of the selection process, so the federal law requires the Medicaid commissioner to ultimately select members of the MAC and BAC. And that can be done through an application process that then Commissioner Lee would select from. Commenters said if an application process was used for BAC members, it should be available in multiple formats, right? So not just online, right? In paper form as well. And that individuals should have access to assistance to complete that application. There was also a lot of good feedback about as part of the application, right, or maybe as a complementary set of information, explaining the roles and expectations for BAC participants, so they understand what they're applying for, right? And then a number of survey respondents raised their hand, right, and said they were interested in serving on the MAC or the BAC. Okay, turning towards the types of additional subject matter expertise that could be helpful to the MAC or BAC. There were a number of commenters who supported the use of specialized subcommittees that could help, focus on specific topics and ensure that many voices are heard. Some commenters cautioned that subcommittees could maybe dominate the conversation, right? And on certain policy issues, and maybe outweigh the voices of BAC members. We did have one commenter that said that subcommittees should be focused maybe in 5 broader areas. So one focused on regulatory matters, reimbursement, advocacy, education, and then access. Those are kind of broader buckets, right, or focus areas that impact the Medicaid program generally. So now let's turn to how often the BAC should meet, as well as the format for meetings. So suggestions on the frequency of meetings varied. Okay, some suggestions included monthly, every other month, right, as the MAC meets now, as needed, which would be dependent on emerging or pressing matters, as well as quarterly. I just want to highlight that federal law requires that the MAC and BAC meet at least quarterly. A number of respondents said that the current meeting schedule for the advisory council of every other month was appropriate for that body. I just want to note that were the MAC to continue to meet every other month, that would mean that the BAC would be meeting either every month or twice a month, because the BAC by federal law needs to meet before the MAC meets. Survey responses, right, encourage continued use of virtual meetings and recommended that to the extent possible, meetings are held outside of working hours. And then in terms of how long meetings are, right, since the BAC does not exist today, right, in terms of how the federal government envisions it, the comments we received are related to the MAC, right? So today the MAC meets for 3 hours, and we received varied responses. Some felt due to the agendas, right, 3 hours was appropriate, and then some commenters said that was too long. So they're not specific comments on the length of BAC meetings. Okay, now let's consider feedback on the types of supports that should be available to BAC members to ensure that they are comfortable in their roles and can provide their feedback. This is probably the survey question that we received the most responses on. So respondents generally mentioned the difficulty of not understanding much of the material that's discussed in the current MAC meetings. And so then suggestions to allow members as well as the general public, right, to have a better understanding would include orientation, trainings, supports prior to the first meeting, sharing agendas and information in advance, which I know that happens today online, right? And then holding pre and post meetings to provide context and answer any questions. And then specifically for supports for members on the Beneficiary Advisory Council, It was noted pretty consistently that the department should have dedicated staff to provide orientation, trainings, address policy questions, and so on, so that members feel prepared, right, walking into both the BAC meetings and then the MAC meetings. A number of commenters wanted to ensure that individuals that are on home and community-based waivers that may rely on a caregiver or a personal care attendant to participate in the meeting, right? We're not using waiver services when they participate in that meeting. There was also support for stipends for BAC members related to any transportation, if the meeting was in person, childcare, as well as caregivers that may be needed so that the BAC members can participate. And then certainly a resounding comment was for translation services, right? So for non-English speaking individuals, sign language, translators, and then either in-person or transcription options, as well as recorded meetings being posted online. And then generally a number of responses expressed difficulty in accessing, basically being familiar with Zoom, right? And getting on the meetings. So maybe some tutorials about interacting with the virtual platforms would be helpful. Then we just want to note that overall, there were a number of comments or themes, right, and comments on member engagement with the department on the Medicaid program. So there was a call for more opportunities for the public to engage with the department on the program, highlighted desire for more two-way communication options where where the department could hear from the public, and then the public could communicate through surveys, online forums. So overall, it seemed like the process was well received for the MAC and BAC in terms of public engagement. We did receive some survey responses that individuals were not familiar with the current advisory council or the technical advisory committees. And those that were familiar were generally receptive and had positive feedback on the transparency of public information. So when the meetings are held, the agendas and the information post those meetings. Okay. And then apologies there, I did not go to. Okay, so there's that slide, sorry. And then just for kind of comprehensive collection of the feedback, we did want to note that the feedback received from this TAC on the back, and that's just reflected here as well. So I will pause there and see if there are any questions on the summary of the survey and webinar feedback on the back. And I apologize for all of the acronyms. So.
It's almost impossible not to use acronyms when it comes to Medicaid, right? Yes. But I appreciate you going over this so comprehensively, and really was excited to see the participation, yes, the numbers, the volume of people who were opening emails, clicking, and then ultimately providing responses to the survey. And also, I think a 50% attendance at webinars is actually pretty good. So especially at the time of year that all of this happened between the, holidays, Christmas and New Year's, I think it just goes to show how many people are interested in really being more involved in Medicaid decision-making and having this advisory role. So thank you for the work that you did here. Are there any questions about the presentation? I also wanted to say thank you to Miranda, who served as co-chair and in my absence provided a report to the MAC at the last meeting. And that included these recommendations, which I know we didn't have a quorum for, so thank you for including them. Mm-hmm. And we appreciate you all taking those under consideration.
And I will just note some of the activities that are underway. The department is working on a dedicated landing page, right? Because there are a lot of different pieces of material out there, right? The webinar slides, the recordings, and then there is a one-page summarized document, right, of the MAC and BAC requirements. So getting that in a convenient spot. And then certainly, the BAC application would likely be located on that page as well. There is some work underway to develop that application for the BAC and the selection process. Just overall planning to make sure that July 9th can happen smoothly, and both the MAC and BAC will be fully ready to go. So more updates certainly over the coming months.
Well, and we hope to see a bill draft very soon. I know that that's something that DMS has been working on. The deadline for the House to submit to file any new bills is tomorrow. I don't know if there's a committee substitute plan to get past that deadline or not, but it would be really good to see a draft of what you all have come up with. So we're looking forward to that. But again, any other questions before we move on? It sounds like things are in motion, and we appreciate the work you all have done.
Certainly. Well, and I appreciate the time on today's agenda.
Yeah, so I've moved things around. I know. I'm looking at my agenda, and I think that we are now at the school Medicaid grant implementation. I think I saw Erica Jones on here earlier. Would you be able to tell us a little bit more about the needs assessment and this parent survey and focus groups that you all conducted at the end of last year?
Hi, Emily. Yes. So the needs assessment, we have completed that final needs assessment for school-based services in Kentucky. We don't have the go-ahead yet to make that public, but we anticipate that happening in the very near future. We did have focus groups. There were 4 different topics for those focus groups. In addition to the focus groups, we also did a parent survey. We had several thousand responses to that survey as well, but all of that information we hope to have available for this TAC and for any others that are interested, probably within the next 2 months. And then the next step for that would be our implementation plan. So planning on what we'll do once we go over all of that information from the needs assessment.
Okay, that's helpful. And our next TAC meeting will be in April. So I should probably just put this on the agenda for April to get a presentation. Does that sound?
Yeah, that's doable. Yes.
All right, I'm just making some notes for myself. All right. Then any questions for Erica about school Medicaid without getting more information about the assessment and everything else that she just shared? Forthcoming. Okay, well, we'll look forward to having that on our agenda for April. The next item here is the DMS surveys of Medicaid members and stakeholders. If you all will recall, these were surveys that were done when the Medicaid renewal process was sort of coming to an end, and DMS was asking for feedback on how that process was working for Medicaid members who went through the renewal process and for stakeholders who were involved in one way or another. I saw Helen on. I don't know if Helen, are you going to give us the update or someone else from DMS?
Emily, this is Beth Fisher with DMS Communications. So I can share some details about the surveys if that's okay with the group.
That would be great. Thank you.
Okay, so I'm going to drop some links in the chat here, and you can actually access the survey results at those links and take a closer look, take a deeper dive if you wish to. But some quick background. So Medicaid worked with our partners at the Altarum Institute, my good friend and colleague Helen Dawson and her team, and we distributed surveys related to the public health unwinding, as Emily mentioned, and the purpose was to determine the effectiveness of our unwinding efforts and to really get a sense of what the member and as well as our partners who went through the unwinding with us, what their experience was and how they felt about some of our outreach efforts, as well as the level of support provided to the public during the return of member renewals. So we distributed 3 surveys. The first 2 were sent in the spring of 2024, beginning in April, and the third was distributed over the summer. And the target audiences included members who had gone through a renewal, Medicaid partners, which included providers and advocates and some other audiences. And the third survey that followed the first 2 was intended for individuals who had actually lost Medicaid coverage during the return of member renewals to get a better sense of what their alternative coverage was. So if we were trying to find out if they had enrolled in private coverage or if they were enrolled in Medicaid or Medicare or had some other form of coverage. So it was to get a better sense of that. So overall, we had 1,200 members and partners who responded to those first 2 surveys. Of course, they were distributed to a larger number than that, but we were pretty happy with the response that we got. The member survey was distributed via email only because we wanted to use the email addresses we had on file for our members to ensure that the survey went only to members. We were concerned about potentially collecting feedback from people who weren't actually Medicaid members, and we were worried about the impact on the survey results. And then that partner survey actually was distributed via email, but was also shared through social media and some other channels. And we got some really good feedback from those first 2 surveys. I'll talk a little bit about our findings here in a minute. And then we actually had an additional 3,200 individuals who responded to that third survey, the survey that looked at alternative forms of coverage, which was a really great response to that. That survey was actually promoted through some of our different channels. We shared some information on the Connect website. So that helped us to attract some more respondents, I believe. And we did find that a pretty significant number of individuals were able to enroll in alternative coverage through qualified health plans on Connect. So that was a very interesting finding. But we will start with the member survey that went to Medicaid members who had gone through a renewal. And for me personally, as a communications person, this survey was very valuable because it taught me a lot about how our members are obtaining information from Medicaid and what is really effective, what they're really likely to engage with. And it's, of course, no real surprise. We did find that the most effective form of communication came from the formal department communications. So those emails and letters and text messages that went out prior to the renewal period coming up for the member, those were the most effective forms of communication for members. But we also found that people got a lot of information from the Unwinding website, which is medicaidunwinding.ky.gov. We used it heavily during the unwinding process. Hopefully everybody in this meeting is familiar with that resource. We did find through the survey process that it was a useful resource for a lot of our members. So that was a great finding. Email is also, it was emphasized during the survey that it is still our most effective form of communication. We use email a lot, but this was a good takeaway for me, just as a reminder to, how we're using those email channels and what kind of messaging we're sharing through email, and just to continue to build some of those distribution lists and make sure that we're engaging with as many people as possible. Also, a little disappointed to learn that not everyone is following DMS on social media. So we're looking at, our social media strategy and how to grow our audiences there. We believe that social media has been a great tool for DMS, and it's great as just an additional tool that we can use to get the message out there. But not enough people know we're out there on social media, so definitely looking for ways to grow our audiences there. Another key takeaway or another next step is just continuing to collect information. This was really, since I've been with DMS, this is the first time we've really done a member survey like this as it relates to member renewals and the eligibility and enrollment process. So this is something that we intend to keep doing and make it a regular part of these annual renewals moving forward. So we're working with our partners within CHFS from the Office of Administrative and Technology Services to make this a regular part of the renewal process. Members will automatically receive this survey moving forward. So that is a very important next step, and I think will be really helpful to us to just understand, what our members experience when they have to renew and what we're doing a good job at, where we can make improvements, which audiences we need to do a better job reaching, and those kinds of things. That is, something that we're working on and hope to launch later this year.
Great. Thank you, Beth. It's good to see that you've published the results. I know that was something that y'all have been working on for a while, and I also think it's really good to make this, just incorporate this into your annual process and to continue to collect data. Sorry, I had turned off my video because my internet was unstable for a few minutes. But I did want to just suggest, in looking at the survey and providing some feedback initially on the first drafts that were, part of this first round. I felt like there could have been more questions asked about certain barriers people faced. And I know that there was a real intention to keep it short so that people would actually complete the survey, which I also appreciate. I know we always have to balance that. But if there could be some, logic built in where someone, reports that they ended up losing coverage or that they just had some unresolved issues, particular barriers that, start to become a theme, I think being able to just ask a few follow-up questions about those would be really helpful. So that would be the one recommendation I would have for moving forward.
Thank you, Emily. We will definitely take that back.
Any questions about the DMS surveys? I guess I should call these renewal surveys.
I'm excited to hear that it will be part of the process, the renewal process going forward. Thanks.
Yeah, our next item here is the access to services form. And I know that this form has launched. It is live, although there was a little blip. And Angie, if you're on, correct me if I'm wrong, but I think that that's also been resolved. I'd love to know, how many people have completed the form so far, and if there's any, just any takeaways that you can share with us.
Sure. Yes, it's launched. Yay. And if it is, and I can put the link, it's on the Division of Quality and Population Health page in the Department of Medicaid Services. It's, but it should be working. We have had 5 submissions. And as you know, we did a soft launch first, and then we did a social media launch. I believe it was a week or 2 ago. Our communications team sent that out in social media. I will say one, and I do have what those 5 are. Let me pull that up here real quick. Maybe. One was assistance with an ophthalmologist, another assistance in finding a neurologist. One that didn't give enough information on the form to see what they exactly needed. So we did a call to them and have not gotten anything back yet. Also, one person who sent in was actually thought it was a form used to apply for coverage. So they were directed where to go. Let's see. Oh, maybe. And then we had one early on without even telling anybody that was looking for somebody with an eating disorder. But so, and those were all in January. We haven't gotten any in February yet.
Okay. Well, I know that at KVH, we've been waiting to just make sure that the form is working properly before we send it out. And so we'll be doing that soon, but I didn't actually catch that DMS had put on social media. So we'll also try to promote that. And I would love to see other TAC members sharing through your various networks.
Let me
And
put
we
the
can just keep
link
this
real quick.
on just for updates on, you know, how it's going, what information you all are collecting.
Aaron, if you can give me access, I can show the page and where it is, and we can do a test drive if you want me to, or you can just go on there yourselves and give it a test. You can just put in Daffy Duck or whatever. We'll know that it's just being tested. But it should be, all should be working fine at this point.
Great. Would anyone like to see a demo? Yeah, it sounds like we should go ahead and take a look at the form.
Angie, you're a co-host. You should be able to share.
Okay. Okay, so here is the page, and it's the DMS, and it's the Division of Quality and Population Health, and tells what we do. And then we have access, member access to care form, and you have it both in English and Spanish. This is the information that we went back and forth a few times and put on there, but I'm hoping this works. Hmm. Go in and fill in your information. This is very important. If, you know, we really want people to make sure they contact their managed care first. They haven't, then, you know, you can still obviously still fill this out. And you have the ability to do the calendar. If you weren't offered one, it does give you the ability to say why. It's like, all that apply, but that didn't work because it went away. So that's good to know. So if it was more than one, but anyway. And then you hit submit. And then this comes out. And there you go.
Right, well, thank you.
The email, the form will go to someone in our quality branch because we review the network. They review the network adequacy reports, and so this is.
Well, and
helpful.
Rachel has real time received the form. That's
Yay.
great.
All right, so we're in business then.
Okay, well, thank you. And we'll start promoting it, and hopefully we'll have more information to discuss at the next meeting. But my real hope with this is that this just helps us to really understand where we need to pay more attention to network gaps and make sure people are getting those appointments. The next item on our agenda is language access. I know that there was a one-pager shared with us before this meeting, so we might want to review that and then also discuss any additional information or materials that y'all are working on.
Well, there's not any additional materials we're working on right now. the one pager was basically giving all the MCO information on how to contact and how soon, if you need somebody in person, and just a high level general understanding. I mean, and basically you're calling member services if you need assistance. And there
Do you
are,
mind
as
to pull
far
it
as,
up, Angie? Sorry, didn't mean to interrupt you. Would you mind to pull up the one pager?
well, let me find it. I should have had that ready.
While we're waiting, I'll say
Okay.
that I think it's a good general sort of flyer. The two things, I guess, that I would like to see in addition. One thing that could probably go on this particular one pager is just putting the number to call in for phone interpretation versus
Mhm.
scheduling an in-person interpreter or scheduling something, in advance. But if you're just needing to call an interpreter line at that moment, is there a language line that could be called? So maybe there's 2 points of contact that could be shared. One for immediate, over the phone interpretation and one for scheduling future interpreters. My other thought is that this doesn't address what happens if you don't get the service that you need. If there's, for whatever reason, you're not getting an interpreter scheduled or you need an interpreter before, sooner than the 5 days that the MCO requires. And in those cases, what can you do? So whether that can go on this form or needs to be on another one, I think it could go either way.
Well, I don't know who put this up there, but this is the form.
I did,
think it's the
Angie.
form, but somebody found it before me.
I keep a separate folder for email blasts, so it was right there on the top.
Thank you, Erin.
Sounds very organized. I like it. Miranda, what are your thoughts on this?
Um,
Erin,
I agree
scroll up.
with your feedback.
I'm sorry, Miranda, I didn't mean to interrupt you.
I was just saying I agree with Emily's feedback.
Is there a lower, yeah, I think we're not seeing the full page here because at the bottom is where those numbers are. So I thought there could be a language line number and then a number to call and schedule an interpreter for, a future appointment.
Does that make it a little better?
Yeah, we can see it all now. Thank you. Any other feedback on this form? And then I do think it looks to me like there's enough room at the bottom to add something short but helpful about what to do if you're unable to get interpretive services, who to contact. And I would assume that would be somebody at DMS.
Well, I mean, this form is primarily for providers. I mean, members obviously can use it too. Because providers can schedule ahead of time, members can schedule ahead of time.
If we could have I mean, either way, if you're a provider, you could encounter a barrier, in getting something scheduled, or it may be that you need to have something scheduled, sooner than the 5 business days. And the same could be true for a consumer, but I am hoping that we can have something to share with consumers as well as providers. I think it's good for both.
I mean, it could be used for both.
Yeah.
If you want to submit some potential language, we can see how or where or what we could potentially add to this.
Okay.
Yeah, agreed. I'd love to see something for consumers.
Miranda, do you have, I mean, would you want to add a line or two that you think would be most helpful? I feel like you work most closely with people who speak other languages and need interpretive services. But I don't want to ask that of you if you're busy with other
Yeah,
things.
yeah, I'd love to. I can't wrap my head around it right now, but I'd love to follow up.
You can send it to me, or you can send it to Aaron, or you can send it to both of us, however you want to do it.
Okay, thank you. I think that would be great. I do think it's a good start. I would just like to see a little bit more information, and particularly for consumers. All right. Anything else around language services before we move on? Arthur, I've been keeping an eye out for any comments from you in the chat. Did you still want to share something for us to read?
Yeah. You posted? You posted on. Yeah. Oh, he said he posted on the chat.
Oh,
Two.
let's see if I missed it.
Comment. Two comments.
I see it now. I see it now.
Yeah.
That our meeting was scheduled for February 18th.
Yeah. He said, can you read it?
Well, actually, I don't know if this is what you intended to post or not, Arthur, but it's the information from our Zoom, meeting link about the scheduled call. Was there another comment?
You post the wrong stuff. He said something ain't right.
Okay.
Check the message.
And you're also welcome to email it to us.
He said, give him a minute. He's gonna look at. Go. Oh, go on with the meeting.
Go on with the meeting. Okay. Well, we've already covered the Mac and back. The only item, and I will say up front, it is a legislative session, and I have been kind of inundated with some bills and other things. I haven't had a chance to go over the dental data that was most recently shared with us, the newer report. I've looked at it just briefly, but I need to really take a closer look. So I think we'll probably need to put that off until the April meeting. But the other item that we have under new business is the federal threats to Medicaid funding and eligibility. And I'll just say that if you've been, following that in the news at all, we were hearing initially that Congress was looking at potentially $2.4 trillion in Medicaid cuts, which would be essentially about a third of the Medicaid budget currently, which would just absolutely decimate Medicaid in Kentucky, but also our entire healthcare system, because whether you have Medicaid or not, it really benefits all of us in one way or another, directly or indirectly. But more recently, the House Energy and Commerce Committee, I wanted to make sure I got that right. The House Energy and Commerce Committee was directed to look for $880 billion in cuts. So that's about $1 trillion. That would be closer to 10% of the current budget, still would have really harmful effects in Kentucky. And I think that it would particularly hurt not only the Kentuckians who might lose coverage, but our hospitals, rural hospitals in particular, and other healthcare providers. So just want to make sure that that's all on our radars. There's also been, the federal funding freeze that was very temporary, luckily, because there was an injunction there. And right now, the funding should be continuing for most agencies and nonprofits that had those federal grants, although we've heard various things about some of them not continuing. But I've already communicated with DMS, and my understanding is that funding is flowing. There's not been any other disruption there, which I'm really grateful to hear. Are there any other updates about changes on the horizon or information that you've received, directives to make changes?
Emily, this is Leslie. I don't know who else is on from Commissioner's office. I might be the only one on. We've not heard of anything like in stone. We've heard rumors. Fear causes a lot of rumors too. So nothing in writing. So I just wanted to make sure that I said that. I do have one more thing before we get offline, if I may share with you, if you don't mind. I sent you a copy of an email that we started sending out yesterday. As you're aware, we had an unfortunate flooding event that started over the weekend. Department of Aging, Department of Behavioral Health, and Department of Medicaid all started working together. We're going to kind of do what we did last year and we started reaching out to folks. We sent out communication. Emily, you have a copy of that communication that went out, just asking those that might could fill out a form to let us know, are you having trouble? Are you stranded? Are you unable? And it's for providers and members. So as you can imagine, some providers have had to relocate temporarily and maybe bill out of other locations that we've not looked at or things like that. So we're trying to make sure that we can get a good overall look at anybody that might need help. We did send governor resources are in the email, as well as the forms for providers and for participants. And we also gave out additional phone numbers that can kind of bypass the regular emergency response and get to our folks quicker, to get you assistance for things like maybe you can't get your medication, maybe you're on a vent and don't have oxygen, maybe you're located on the second floor and you can't get your members down to the first floor, you can't evacuate to another location. So I just wanted to let you know that we started yesterday. Just the waivers alone was over 30-some thousand. We're trying to get located in counties and get to case managers to make sure that they can reach out to their providers and their members as well. So more to come on that. I'm sure the governor will be giving out information related to our efforts to assist. The little programs yesterday, we just went ahead and we all just like kind of chipped in and started calling. PACE programs are small, so we could call that. The ABI providers were small. We started calling ABI providers, just little things that we could do. But we do know that even nursing homes, PACE centers, some of those were affected as well. That's it.
Yeah, thank you for sharing that, Leslie. And I appreciate how quickly DMS has responded. I remember this also being the case during the last flooding and also with tornadoes, where y'all really very quickly pivot to make sure that people have the information that they need and that you can get in touch with them, take care of
We're
their
trying.
Emily, I attached the email from Leslie to your all's follow-up, so the whole TAC will have it after the meeting.
Yeah, thank you. And we'll be sure to share that with our networks.
Emily, this one was a little bit
Arthur.
different as the last time the governor announced a state of emergency. I think for 14 counties, this one was 120. So
That's right.
and
This was the first
that's a
time
sad
ever
state.
in the entire state.
So, yeah, we're working, nobody injured or anything like that this time. We do know of, just, people being, having to go to churches and things like that for different locations, people that are operating on second floors instead of first floors and things like that. But so far, haven't heard of anybody, injured or anything that, can't be remedied so
Good.
far.
I appreciate you sharing that. Arthur, did you have a question or a comment here? Or are you just talking with your assistant?
That's one.
No. No question.
He said, can you see it?
Oh, is your comment in the chat now? I
He
don't
said,
think I've seen it now.
he said it's next to the last comment on the chart.
I wonder
What,
if it went to an individual and not to everyone in the chat box.
Yeah.
That's probably what happened. If you can select everyone in that green or that blue box, and then share your message, we should be able to see it. And Krista, thank you for offering to share an update from UHC. If we have time after looking at Arthur's message, we can let you share an update with us.
Say everyone. I think now you should be able to see it because he just changed it to everyone.
Okay. I'm still waiting, but it might be popping up any minute.
You just want to resend it? Now that everybody can see it, it's going to be able to show up on everybody's. No, I can't. Yeah.
Arthur, I
On
think
your,
you'll need to copy it out of the private chat and then paste it into the public chat under everyone.
okay.
Okay.
Okay. Here. Is it this one? Yeah. That's all? No. I don't see it. It just stops here. Keep going down? No. No.
Well, Arthur, while you work on that, just going back to Medicaid funding, the one thing that I was hoping we could get from DMS today is just some updated information or whatever the most current information you have is on, not only the people enrolled in Medicaid, but, what that reimbursement looks like in every community. I know you do these wonderful fact sheets, state and county level, and if you could put the most recent fact sheets in the chat for us, I think that would be helpful, just so that we can have a better sense of our local communities and, what communities may stand to lose if we have a cut in federal funding.
You want to paste it? Yeah, I'm not that. What are you trying to do? Yeah. He said he would email it to you. Something is
Okay.
wrong.
All right. Yeah, thank you very much. Arthur, we'll keep an eye out for that. And if it's something you want to discuss at our April meeting, we can add it to the agenda. One more question before we turn it over to Krista for any updates. Are there any recommendations that folks would like to put forward? I don't have any at the moment, but I think working on this language access form is sort of our next step. And I think we can do that without making a recommendation at this time. But if anyone else has something that you'd like to put forward for a vote, let's do that now. Okay. It sounds like we're not going to do recommendations at this meeting, so just think about any recommendations you want to bring to the April meeting. And Krista, if you have an update for us, we'd love to hear it.
I was just going to go back to the weather events across the state of Kentucky this week. Unfortunately, we've sort of developed a playbook of sorts, having been the third one in just a few short years we're going through. As of, I think, Sunday night, we'd accounted for most of our employees, finally made contact with our last employee late yesterday. So that was lovely and anxiety provoking. We've been in contact with KPCA and some of their member clinics that are in some of the most prone areas or impacted areas. Similarly, my team's been in touch with KHA. Starting Monday morning, my clinical team did two things. One, did outreach calls to every member that is enrolled in our case management program to make sure that they were, first of all, safe, and that if they needed any extra assistance procuring or replacing medications, equipment, etc. And then our team quickly ran a report on anybody who had a claim for any type of device that requires electricity, to then make those members priority outreach, whether they were in case management or not, to make sure that either they had a backup source of power, or knew where they could go local in their community, to make sure their medical equipment was powered up. So just a couple of nuances on top of what Leslie had communicated from DMS from an MCO perspective, how we approach it and try to triage, our employees, the providers that serve our patients, and then the patients in order of priority of impact or what level of help they might need. And then we've divided up the list to call the remaining. As articulated, this one is a little bit more challenging, impacting all 120 counties, versus being more geographically bound in scope, but it's what we're here to do. And I will tell you, most of the time when my entire leadership team starts getting on the phone and making these calls alongside of our members, it's incredibly rewarding because the member patients that we make contact with are so appreciative, that someone cares about them, and somebody wants to make sure that they're okay and that their families are okay. So just a quick update that even in the midst of tragedy, some real goodwill is generated across those we interact with.
Well, thank you for that, Krista. And I think that proactive outreach is so important. So I appreciate you sharing that, and also that you have a playbook now. Yeah, it's these weather events are going to continue happening, and it's good to be prepared. Any questions about the flooding or the response to the flooding? I did check my email, and Arthur, I got your email, so I'm going to go ahead and read this. It's actually pretty short, so I didn't want to wait until our next meeting. It says, I am Arthur Campbell Jr. I represent protection and advocacy on the TAC. I have to apologize to Madam Chair and the rest of the TAC members for missing the last TAC meeting. The reason that I missed the meeting is for several months I haven't been feeling well, and frankly, I just forgot the meeting. I apologize. I'm glad you're feeling better now, Arthur, and that you could join us today. And then it goes on to say, I read the minutes of the meeting, and I want to thank every member for being so considerate of people who are nonverbal. Transition programs came out of the Olmsted decision. That's good to know. And there's been a survey out for quite a while now about the Olmsted Act and collecting feedback there. So it's always nice to know that history. Well, thank you, Arthur, for sharing that. And looking at our agenda, I think we've made our way through it. It doesn't sound like we have recommendations. I'll be representing our TAC at the next MAC meeting. And our next consumer TAC meeting is April 15th at 1:30 p.m. Eastern time. So with that, I never remember if I make a motion to adjourn, but I think we adjourn by acclamation.
Okay.
So should I take a motion?
Yeah.
I need to go. Okay, Arthur, would you like to make a motion to adjourn? I'll take a second.
Did I hear? Do I hear? Do you hear most mustard? What she said? Your head. Show me that. You don't have time. You Mac. Someone made a message. Sorry. I don't know why it's What did you ask? What do we? What do we ask? Ask at the end. At the end of the meeting. What did you ask at the end of the meeting?
Oh, for a motion to adjourn.
I can second it.
Okay, Arthur makes a motion. And Brenda seconds.
Is that what you were saying? Motion?
Oh, excellent. Okay, great. And all in favor say aye.
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 Any opposed? All right, motion carries. We are adjourned. Thank you all. And I will see
Yeah.
you in April.
Bye-bye.
Bye.